A dental implant is the gold standard for replacing missing teeth. The difference between an implant and something like a bridge or a denture is that implants don't damage the adjacent teeth. They go directly into your jawbone, they're fixed in place, they're solid, they look like natural teeth, and they actually add a lot of strength to the mouth rather than just putting it onto other areas. So the majority of patients are suitable for dental implants. It's really important to come in and have a special assessment specifically to your mouth in terms of, is the area suitable? Is there good bone? Are you medically suitable? Is this something that's actually a good idea for you? Are you a dentally anxious patient, or would you be better doing something else? But I think the best way to do it is to come in, because we'll tailor the treatment to your exact needs, and being able to sort of work that out together is usually the best way to move forward. So the process can vary from patient to patient. It all depends on, are you currently missing the tooth? Have you got the tooth in place but you've been told it needs to come out? It's not always a one-size-fits-all treatment. On average, you're probably looking maybe kind of 3 to 6 months, depending on how much bone's there. Do we need to do bone grafting? But it's all again about tailoring it to exactly your needs, and doing it in a timely manner, but not rushing things. We'll do it in the best possible way. Generally speaking, nothing that we do should be painful while you're having the treatment done. We use cutting-edge technology, really thorough use of local anaesthetic to make sure you're comfortable through the treatment. Generally, with any treatment, there will be a little bit of a healing process, and again, we're able to advise patients directly on the best kind of times to do things. But generally, when you're in here, your treatment should be pain-free. Dental implants are one of the most successful treatments that we provide. Our average is looking about 97% success rate. Usually, if you look after them, you come in and get your regular hygiene maintenance care, you keep them clean, you do the kind of instructions we follow with you, they should last a really, really long time. All dental treatments, there is always a small risk of some sort of complication. More commonly with implants, you can be a little bit tender afterwards. If you're doing bone grafting, sometimes it can feel a little bit swollen. That's all normal, part of the healing. And a small number of implants, the implant essentially won't take, and that means the body rejects it. When that happens, we call it an implant failure. All that happens in that case is we'll do the same treatment again, no additional cost, and at the same success rate as well. So generally speaking, even if you have an implant failure, you're completely suitable to have the implant done again. Generally with an implant, they are super solid, so you can use them once they're ready to go, completely like a normal tooth. Super important to keep them really clean. Our hygiene team will give you a really specific program for exactly how to clean each implant. Every tooth and every patient are different, so it's making sure you have the exact correct sizes of brushes or tools that are going to give you the best chance of cleaning them. Generally speaking, an implant should feel natural and look natural. It all comes down to exactly where it is, particularly in front teeth. We do everything we can to make sure that they look exactly like a natural tooth would. In some cases, if you've been missing a back tooth for a long time, it sometimes looks slightly different if the gum has receded back and is shrunken away. But generally speaking, it should look and feel completely solid and look like a tooth. For most of our patients, we advise after having dental implants that you do have a sort of formal maintenance program in place. Generally speaking, that ranges between maybe coming in every 3 months to see one of the hygiene team, and then having a strict at-home protocol. We often invite our patients to join a pain-free plan, which includes all of their checkups, their maintenance, and x-rays and hygienes after the treatment's completed. So generally, if someone is maybe lacking bone to place the optimum positioned implant, we will advise on a small bit of bone grafting. We do that a couple of different methods. Often we can do that at the same time as the implant's placed, but in some cases we'll do it at a separate visit. Generally, it might add a little bit of time, to the full process, but it will, increase our success rates if we do the proper grafting and do things to the best quality standard. In terms of the costings, we go over everything in detail with each patient before they start the treatment about what to expect with that.